Thanks, Jonathan. Hello, everyone. So, welcome to the podcast. So, as you all know, today's session marks the second segment of this live podcast, courtesy of MPSYPC. So, I understand that it's a very long weekend over the Diwali break. So, thank you very much for making time to join us on this podcast. Let's hope that it will be an enjoyable one for all of us. So, today we'll be tapping into the topic of patient touch. But first of all, for those of you who know me, I must say that it has been an awfully long time since I last met all of you in person. So I guess it's rather nice that we get to reconnect and to get in touch again through this platform. And for those of you who don't, I go by the name of Ren Zhang, and I'm a nuclear pharmacist in Penang General Hospital. So that's just a very quick introduction about myself. So as for all of you here, I believe are committee members of MPSYPC. So you should know by now that I'm not a part of the committee. But nonetheless, I am very, very thrilled and excited to be a part of today's session and to be invited as the moderator because I've always looked forward to be speaking and chatting with our amazing speaker of the day. So today's session, I trust, is going to be an eye-opener. No doubt it is an educational one, but at the same time, it is going to be very interactive. So feel free to chip in whenever and wherever. So preferably just unmute yourself and speak to us. I think that would be very nice for us to get to know each other better and to see each other virtually rather than the chat box because I'm not very familiar, but I'll see what I can make do with it. So right, patient touch. What is patient touch all about, right? So oftentimes, I believe we as healthcare providers working within a healthcare setting, we're the ones giving information to our patients. So that makes us the people who are doing the talking most of the time, right? Actually. So, but we're very well aware at the same time that for an effective communication to take place, it always has to work both ways. So we need information flow from both parties in order for us to come to a conclusion that will benefit our patients in the long run. So today, we've invited our esteemed guest speaker, who happens to suffer from a condition known as endometriosis for the longest of time, to share with us her story and her experiences throughout the course of managing her condition. But before I introduce this special guest of ours, just to highlight the main objective, as we all know, today's session aims to emphasize on the importance of putting ourselves in the shoes of our patients and to allow them to participate in the process of their own recovery. And of course, to actively listen to their concerns and problems before jumping to any conclusion. So with that in mind, I'd just like to quickly throw a question at Jonathan, the person behind the idea of today's topic. Jonathan, you there?
Yes.
Yes. So Jonathan wasn't expecting this, but yeah. Wanted to ask, what was the inspiration behind this idea? What sparked an interest in you, to want to get in touch with patients and to hear their stories from their point of view?
Okay, so I would say that because for myself, I didn't really start off my career in the hospital. I started straight away in the industry, and the time I actually exposed to endometriosis, and that was my first time I met Surita during one of the our event. So during the time, it's like we have a patient advertisement board, so we have a lot of patients which share their journey on that day. So it's really sparked my mind that how can be this happening? That's really happening over here, that because we have been go through our study, we think that actually for our role here is to help people, but somehow when I heard the voice from the patient, they're actually saying that nobody care about them because when they actually have the pain, but nobody understand them. They just treat them like, oh, you are just like normal thing. Like, why you just come back with it? We have more urgent patient is waiting on the queue. You just be patient, just sit there and wait. So this really something sparked my mind. Like, oh, I didn't really know this is really happening. Yeah, right. Probably some patient that might have more serious condition, but we still need to put like a equal care to everyone. Yeah.
Right. I think, yes, as healthcare practitioners, especially if you're working in a facility that is very jam-packed with many patients, we tend to overlook a very important factor, which is patient's emotion. And that plays a very critical part in the patient's treatment because when the patient's emotions are being neglected, I think there will be generally a lack of trust from the patient because they feel that they are not being heard, their voice is not being heard. And that would be a very big challenge when we want to deliver the best care for them, right? So very well said, Jonathan. I highly agree with what you just said. So I hope that by the end of today's session, all of us will master an art or two on how to better correct our methods and to pay true attention, mind you, true attention to our patients in order to provide better care for them. Right, enough of me speaking. On to our speaker, the lady herself behind the inspiration of Jonathan's idea of today's topic. She's been a lecturer for 2 decades and counting, still very young by the way, graduated with a bachelor's degree in PESEL. She then earned her master's degree in education admin, and she's now pursuing her PhD in health communication. She's the president of Persatuan Endometriosis Malaysia, also known as Endometriosis Association of Malaysia, or in short, MyEndosis. She's an eloquent speaker, trust me, and she's done talks which have taken place in different parts of the world, focusing on her main interest, of course, endometriosis. She's a happy wife and a happy mother, and most importantly, she is a strong woman through and through, and she's none other than Miss Surita Mogan. Hi, Surita. Welcome on board.
Hi, Ren Zhang. Thank you so much. Well said, but I wonder if it reflects on me. Eloquent speaker, I want to warn all of you, sometimes when I talk about this, it does trigger so much pain, you know. So I might cry or shed a tear, but it's real, you know. So what Jonathan said was actually very true when he met me and he met the rest of the patients. We were all, well, in a very lonely place and very misunderstood. But before I talk about this, I would just like to say thank you so much to Jonathan for inviting me today, and of course Ren Zhang. Okay, thank you so much. I'm truly honored to be invited to speak about endometriosis from a patient's perspective, as well as an advocate on creating awareness on endometriosis. Now, I truly believe that invitations such as yours is meaningful to me because in addition to all the misunderstanding that's going on, it indicates that HCPs are willing to give us a voice to speak about this truly misunderstood health condition. So thank you so much, Jonathan and Ren Zhang. Thank you.
It is an honor on our side to have you on our podcast today because you know very well, no words will do you enough justice.
Yes.
But nonetheless, like you said, hopefully we'll not shed any tears, but if you do, they're all real, and 1 tear shed equals to 1 point stronger and 1 move towards a better future in terms of healthcare, especially for endometriosis. Right, so Surita, why not let's begin with you sharing with us a little bit more about yourself and what you do at MyEndosis.
Well, basically, this is not my plan. You know, I have this condition. I'm a patient myself. And I've been suffering for years since I was in my late teens. I have this chronic period pain, and from 1995 up to the year 2013, I would say it's a very dark period of my life. It's where I am seeking answers. At the same time, awareness on endometriosis was extremely, extremely low in Malaysia.
Yeah.
Had problems with everyone, my family members, my spouse, my employers, and simply because when you talk about endometriosis, it's connected to period. And people have this impression that period pain is normal. And whenever we give excuse that we have pain and we are in pain, people truly believe that we are exaggerating our pain. So when awareness is very, very low, a lot of us are, I would say going through depression. We don't know how to cope with the community. And this, I feel, is a dark period. And that's when I started communicating with patients from abroad, particularly this group known as World Endomarch Inc. And
Yes.
they indicated to me that there's no one in Malaysia representing patients from Malaysia. And I wasn't sure what I was doing back then. So anyway, I agreed to be the country captain in Malaysia. This was back in 2013. So with a group of Malaysian patients as well as caregivers in Malaysia, we registered our group. and we are now known as Endometriosis Association of Malaysia, for short, MyEndosis. So that's how it all started.
Right.
Yeah, I will talk about my own experience dealing with HCPs and how we were always misjudged in the wrong way. But this is how MyEndosis existed. We registered our organization legally.
So out of curiosity, like, are all the people working with you in your team, are they all suffering from endometriosis?
No, they're not. All right. Believe it or not, we have males in our committee. Yeah, so we wanted it to be a community effort to create
to be more inclusive, right?
Yes. And in my team, we do caregivers. They're not patients. They don't have endometriosis, but they are there to help. And a lot of us are simply caregivers, patients, a combination of spouses as well. Even healthcare professionals, we have been getting them in as well. So a lot of them are members. And I'm glad that I'm doing this talk because I'm also keen to appeal to the Pharmacists Society to actually join us as well.
Right, and I think it's incredible what you're doing there. So I understand that MyEndosis was established in 2013, like you've mentioned, and it's affiliated with Worldwide Endomarch, right? It's based in America, correct?
Yes, correct. So we actually started interacting with them in 2013, but we registered our association legally in 2014. So simply because we wanted to make sure that we can do things. You see, majority of us are not doctors, okay? So it will be a problem when we want to deal with the ministry, health ministry, Ministry of Women, if we don't register our association legally. So that was our first monumental step, I believe. It's to register our association legally. And from then on, we didn't look back. You know, we were creating awareness nonstop, and particularly creating awareness to the community on endometriosis.
So I think the fact that you are an inspiration of today's topic speaks a lot of volume for yourself. So let me just ask you a quick question. Like, you were the inspiration to Jonathan behind today's topic, but what was your main inspiration to get this, association kickstarted? What made you want to represent all the women in Malaysia suffering from endometriosis, to be their voice, to be their channel, to be their platform, and to connect with a worldwide body, very well established worldwide body that manages, endometriosis?
Well, I think, Ren Zhang, majority of the time, it's us being misjudged in the wrong way. And that's what I would say a trigger point for us to actually create awareness. A lot of us patients, we were looked in a different way. Many of us were deemed mentally unstable, and even employers normally look at us and say, oh, all right, you're seeking attention or you're lazy. So this is the mindset that we hope to change. This is the perception that we hope to change. Having endometriosis is real. It's a real condition. And because it's related to period, you must know that there are women who don't have endometriosis. So many of them, when they interact with us, they said, oh, period pain is normal. Why are you exaggerating your pain? Why are you creating a fuss? Even
among women, right?
Yeah, we were misjudged wrongly. The harshest judgment actually came from women. And the strange thing is, when I was in my teens, back in 1995 up to the year 2013, we had, or I myself experienced harsh judgments from doctors, HCPs themselves, nurses who mocked us, and people around us who think we are not normal, we are seeking attention, we're exaggerating our pain. And well, this is the disturbing thing. I wanted to tell you this, and it's good that we're talking here. Typically for every patient, we normally have a starting point where we experience pain, and the pain got worse as the years go by. Same like me, I started having pain back in 1995, and it got worse. And typically, majority of patients like us, we are on painkillers most of the time. sometimes before period, sometimes during period, even after period. And for me, back then, I would only have 15 pain-free days. I kept seeing GPs and they kept giving me painkillers. A lot of the HCPs will normally give me painkillers, and the painkillers kept getting stronger. And none of them, a long time ago, referred me to a gynecologist. And majority of them were very insensitive. They didn't acknowledge my pain. And then, of course, many of them implied that pain during period, dysmenorrhea, is expected, and women should tolerate it. And I remember vividly one GP in particular, he mocked me, and he mentioned this. He mentioned that Indians have very low pain threshold.
Oh, how terrible. What a thing to say.
Barely seeking attention. So you can imagine that time I was not married. I was with my family member. Here I am trying to convince my family member that my pain is real. And at the same time, during consultation with a doctor mocked me. So it's like a vicious cycle. I go back home trying to convince people that my pain is real. You know, it's never ending. So this is what us, patients, and even caregivers, spouses, friends of patients, to do something like this. That's what we did, and we never looked back.
That's incredibly noble and very, very kind of you to do that, because I believe that oftentimes, you know, when we suffer from a certain condition, as human beings with values and principles, we just don't want the same pain or suffering to be reflected onto another person's life. But then again, we've heard plenty of people talking about wanting to do something for the world, wanting to change the world, but very few actually take the first step to do so. You know, we've been taught from young, like, action speaks louder than words, and I am a true believer of that statement. So it's incredible what you're doing, and I really hope that, you know, your hard work will continue to show many, many, you know, good signs for the women in Malaysia. So let's just have a quick...
Sorry, Ren Zhang, I just wanted to also tell you this. Another trigger point would be, if you look at a lot of patients, we were all diagnosed more than 6 years, typically.
Right.
Many of us, we have experienced symptoms, but we were diagnosed years later. This is the thing that we want to change. That's the real reason why we set up this association.
Let's hope that your objective will be met very soon, because you're actually working with HCPs as well, right, nowadays?
Yes.
Well, at the end of the session, and hopefully in the near future, let's see how pharmacists can come in to be helpful as well, to contribute to the process.
Thank you so much.
Right, let's just go over to our audience and see if any one of them may have actually heard of what endometriosis is all about. Like, if you have any of your family members, relatives, or, you know, any friends suffering from endometriosis, perhaps you can just come on screen and share with us what you know about endometriosis. Or even in the chat box, I guess I got a hang of it. I know how to access the chat box. Anybody? Well, I'm not sure if our audience is shy or like, but perhaps like not many people have actually heard of endometriosis. Like even myself, I don't think I've heard of any relatives or friends, you know, who suffer from this condition. But I honestly believe as well at the same time that if anyone were to be diagnosed with endometriosis, it is not something that they will talk about a lot to people or even among their peers. I think it's something very private, and they would rather keep it within the family or even within their own spouses. So I'm not shocked, but correct me if I'm wrong. You have worked on this topic for so many years. Just correct me if I'm wrong, because I wasn't very familiar with this topic. It's just from some read-ups after our interaction the other day. I understand that there will be a lot of like lesions that form, usually in the pelvis, but these lesions can actually extend to multiple sites all at once, you know, like in different parts of your body, like in the bowel, even in a diaphragm just below our lungs, and even in the pleural cavity, the lung cavity. So in other words, there's just a lot of, you know, ongoing inflammation. And with the inflammation comes a lot of like inflammatory changes in our body, with particular to the reproductive system, which is very bad because all this you will incur a lot of pain for the ladies. Like the pain that you have experienced, and I'm sure no amount of words, that I can put to justify the amount of pain that you have experienced due to the condition and the emotional pain that comes, following the process of seeking for treatment. And I also understand like the symptoms can be very mild. So things like dysmenorrhea or even like chronic pain, I think some women without endometriosis have them as well. So that's the difficult part of getting the diagnosis done properly, because it's often, misunderstood as it's just a common pain. Most women have it. You shouldn't be exaggerating, which is why I think because of that misconception, you ended up taking painkillers for such a long time without actually treating the root cause. I think that's very bad. And I think the more severe thing, the more debilitating effect of endometriosis will come to things like possible infertility. Because I think infertility to a woman and her family is something very damaging, especially without proper understanding and support from the family members. It can get very bad and it will affect someone's emotional status very badly. Like, I hope I didn't say anything too wrong about the condition. This is just a short introduction for our audience. So with that said, perhaps, you can tell us a little bit more about your own journey, because you've mentioned like in very brief details on what happens and what are the misconceptions that led you to wanting to start this association. Let's just go a little bit more in depth in terms of your journey from your first discovery of symptoms to you finally seeking proper treatment for your condition.
Okay, like I mentioned before, Ren Zhang, previously it was just pain and pain all the time, and it turned into chronic pain, so much so that I have to rely on painkillers. And before I got married, it was just painkillers every day, almost every day. And I'm truly thankful that I have an aunt who was a nurse in Kuantan. Way back in 1999. She's retired now. So she was the one who took me to see a gynecologist. None of the GPs referred me, but she was the one who took me to see a gynecologist at the hospital where she worked. And that was when I was told I have endometriosis. Now that's
after how many years?
So hard to pronounce, I can understand why people don't know about endometriosis and why you don't know about endometriosis, because it's hard to pronounce this word and nobody has heard of it. And I was only diagnosed 7 years later, back in
7 years.
And this is via a surgery. I was diagnosed via laparotomy surgery.
Mm-hmm.
And actually at that time, when I was told that I have endometriosis, I was happy. I was happy because I know that my pain is real and valid. And it gave me that vindication that I need from GPs who dismissed me in the past and
Yes.
people around me who were not supportive. But the impression I got when I was diagnosed was that from the gynecologist itself, that my pain will go away after surgery. And the solution to solve my pain is to get married and get pregnant. So that time when I was diagnosed, I was not married. And
Right.
so I was told to quickly get married, so that was what I did because I wanted a solution for the years of suffering. But that is not the case. Now we know that pregnancy doesn't solve the problem.
Right.
It's a lifelong condition where there's no cure. We have to actually manage our condition. So that's the tricky part about endometriosis. And the fact that there's a taboo in talking about menstrual health makes it even complicated for us to talk about period.
Correct. So would you say that these symptoms have affected you personally, like in terms of your daily living or even perhaps like in terms of your relationship with the people around you, your spouses, your family? Has this condition, sort of become like a barrier?
Yeah, Ren Zhang, spot on, because this condition really, really crippled me emotionally as well, physically as well as emotionally. And I can speak on behalf of all patients. Majority of us don't speak up about this. I'm speaking out about this because I don't want young females to pretend. We go through a lot, and sometimes very harsh judgment from the community. I face a lot of hurdles even with my spouse who doesn't know what endometriosis is, and even from my family members, from my employers. They were very unpleasant as well. So a lot of times it's a difficult, long journey. Prior to setting up this association, I would say it's a dark period. A lot of us Malaysian patients, we don't know what to do, you know? So it affects us in all our, whatever that we do. And you must understand that patients like us are from between the ages of 15 to 50 or 60, and we're all in our productive years. And because we have this condition, we are unable to work effectively. We are unable to be good mothers, and some of us have fertility issues. We spend large amount of money on conceiving. I personally have a very unpleasant fertility journey as well. So it does take a toll on us. But again, you don't see this out on the open. We don't see patients talking about this. And our association hopes to change that. So we are bringing in more patients to speak up, and we're putting a voice on this misunderstood condition, endometriosis. And you must understand that, again, some of us, we don't just have endometriosis. We have, like I have endometriosis, I have adenomyosis, I have endometriosis of the bowel, like what you mentioned earlier.
Right.
So some of them, they have thoracic endometriosis, which affects their lungs. So you can imagine the craziness. You know, we have different types of endometriosis, and we have patients who have mild symptoms, and some of them are who have severe symptoms. So it's also very complicated to treat. And this is the challenge that we face. Whenever we create awareness, we try to bring in doctors, medical doctors, to explain what this condition is, so that we hope by doing so, we can actually create awareness. And you're right about the fertility issue, Ren Zhang, because majority of us, we face challenges. Of course, there are some of the patients who are able to conceive, but some of us, we needed help to conceive. Like for me, I needed help, and I couldn't conceive. It was difficult, and at the same time, I couldn't even carry my babies full term. My son, who's 10, and my daughter, who's 17, both of them were premature babies, and I lost one baby. I carried him up to 7 months, and he passed away in me. So it's just a horrible experience, but the blessing is I have two, but majority of them, they are still struggling with fertility, and some are still not in luck to have any child.
I'm so sorry to hear that. But at the same time, I would say that I very much agree with what you say. The lack of understanding of a disease doesn't warrant the lack of empathy from a healthcare practitioner. And the voice that you're trying to represent is precisely the voice that I feel needs to be heard by all the HCPs out there, because until it happens to you, whatever you learn from books will not reflect in your practice, because you don't know the full picture. Like when we say pain in a certain condition, yes, you know, like pain in this condition means it is this disease. But how can this pain reflect on a person's life, on your patient's life, and how it will lead to like a domino effect of many other conditions, you know, with stress nowadays, with mental health, you know, poor mental health, it leads to so many other conditions that are on the rise nowadays. So I really hope that the voice that you represent will soon be so loud that everyone in Malaysia will hear of it, and every woman in Malaysia suffering from endometriosis will be heard. Like they will not be shy to talk about it. I hope that it will not continue as a taboo to speak up on the condition, and people will actually have the desire to seek for proper treatment. Because we're well aware that when it comes to things like hypertension or diabetes, these are so often mentioned that people don't shy away as much as when it comes to topics related to reproductive health. To talk about endometriosis, like you don't even know what is it. So what more, how to manage it. and or even to talk about things like infertility. It is a shame to some people because growing up in an Asian community with Asian values, I think for a childbearing age woman not to be able to conceive, it's such a huge pressure on that woman because there is always this continuity of family succession and whatnot that happens. I think not just in Indian community or Chinese community, it's generally just an Asian thing. Like it is so important for a woman to get conceived, like to be able to conceive. So it must be very hard. Like, like how would you describe it? Like how hard was it for you to first open up about the situation?
I totally agree with you with whatever that you mentioned just now. You see, the impression that we give to people is number one, we don't know how to handle our pain, and pain is normal when it comes to period. So this Asian mentality has to change. The taboo about talking about menstrual health, the taboo about women talking about pain. And I think the impression here is we shouldn't be talking about period pain. And of course, in some communities, even talking about period is considered unclean or not supposed to be mentioned. So this is something that we have to address. And like what you mentioned, Ren Zhang, fertility is a big, big problem. You see, when a woman is unable to conceive or unable to conceive easily, the impression is they're not women enough, or they're not able to do what it's natural for them to do. And that places a huge pressure on the patient as well as the spouse. So, and it's not only about married couples, we're talking about single women who have endometriosis. A lot of them actually came to us and said they don't want to get married. They are fearful. They are fearful of going through this journey. Number one, they are fearful of facing the community, and they don't know whether anyone wants to get married to them when they disclose that they have endometriosis. This is how detrimental and bad the condition is. And it complicates matters when even HCPs themselves will tell patients that, oh, you might have problem conceiving, or you need to do IVF straight away. So again, it's a big hurdle for us. Again, when we talk about Asian society, it's not easy. It's definitely an unpleasant topic to talk about. And even for males, if their spouse have endometriosis, they are unable to talk about this openly. So that is why our association is trying to create endo brothers. We're trying to create a subset of our association where only males are in. Because sometimes I think when we want to get spouses to speak about this, they are reluctant. Because the community, Asian community, the perception that we shouldn't be talking about this. So we hope by starting this and we hope that males are able to speak openly, like yourself, So that's what we hope to change.
And I hope that will work out, because I believe for a woman, if their spouse is, proud of them, like despite the condition that they are going through, to be able to speak about it and to participate in their process of recovery, the moral support gives, I'm very sure it gives a lot of strength to the woman, because there's already so much that she has to bear with the condition. What more when there's a lack of support and understanding? So I truly believe that with proper support, that more women will be able to get through this. Let's really hope, let's pray together that it'll come to fruition soon, in the near future. So you've mentioned that you've worked with many women, and because the association has been established for years now, so I do believe that you've worked with many women who suffer from endometriosis. I'm not sure if it's allowed for you to do this, but is there one particular encounter in the back of your mind that you think would be very impactful to share with us today?
I would say majority of them who approached us, they have some sort a similar story, some sort a story where they were misjudged. I have encountered one patient who actually told me that her husband left her because she couldn't conceive, and she was trying to make him understand, and it was a very difficult marriage to a point that he left her. So she came to us and said, what can I do? And she was really, really broken spiritually and emotionally. So this is what's disturbing about endometriosis. You see, I'm talking about this here, but still it's not out there. We do see once in a while articles on endometriosis from the doctor's viewpoint, but not really the patient's. So that is why our association is important. We want to highlight this hidden information from patients that's not out in the open. And of course, by highlighting this, we hope that the community will look at us differently. That's our hope.
Yeah. And having had so many encounters, as a patient yourself, what would you consider to be red flag symptoms that warrant a visit to a gynae? Like, how should one gauge as to when they should seek medical attention? Because I think people need to know about it. Like, they need to know when they should seek for help, especially from gynae, because you did mention back then, referrals to a gynae is like so obscure, it doesn't happen at all until your aunt, who was a nurse, needed to bring you to one. So thank God for her.
Yeah.
So what would you consider to be red flag symptoms for the women out there?
Yeah, so that's what we are hoping to change, Ren Zhang. We wanted to create awareness so that anyone who's listening would be able to identify any of their family members who have it. You see, the problem with gynecology visit or gynecologist visit is this. Women in Malaysia and even the Asian community, we tend to only see a specialist when we are unable.
And there's a problem, right?
And there's a problem when we are unable to conceive. It's not something where a mother would bring her daughter to see a gynecologist. Usually there's this perception that pregnancy will solve the problem, or you just have to wait when you're pregnant, then everything will be good. So we want to change that mindset. We want people to know about this condition, so much so that they know if anyone has it, and they would actually tell individuals like that to seek treatment. Okay, so seeking treatment very early in the stage is very, very important, because endometriosis is a debilitating condition. It gets worse as the years progress. And if you don't seek treatment early on, it will be a problem as well. And of course, seeking treatment to the right person is also important. The known fact is not many doctors are clearly aware of the challenges patients like us face. Why I'm telling you this is because a lot of times we got feedback from patients who said some single patients who doctor insisted that they should get married, and some patients who don't want to conceive, but doctors insisted them to get pregnant, so sometimes HCPs themselves need to be able to look at patients differently. And every patient, they have their needs. Some of them, they want pain management. Some of them, they want fertility help. So the trigger point would be to look at pain. If the pain affects you in so many ways that you cannot attend any social gathering, you're in pain constantly, your life revolves around your period, then I would consider that as not normal.
Right.
You should actually immediately seek treatment. And so it can be endometriosis. It also can be other conditions like fibroids and PCOS and other conditions.
Correct.
We have to change people's mindset. As soon as they see their child or their daughter or anyone they know having this problem, they should actually bring their child to the correct specialist to actually look and see what's going on.
Correct. Yes, because I think like when it comes to, again, reproductive health, we've mentioned earlier, like it's so difficult for someone, for us to convince, like even among HCPs who believe that people need to go for a routine checkup. We're not even talking about general health. The routine checkup for general health in Malaysia is also rather bad. like
Very
in
good
general, not
points.
even just endometriosis, because
Mhm.
people don't go for checkup unless they already have an existing problem or there
Correct.
is already an existing abnormality that they can feel. So we're not even talking about abnormalities that have arises from like over the years that builds up along the way. This is upon feeling the abnormality that people go for health checkup. And usually when that's the case, it tends to be too late because it has advanced to a very bad state. Like you either need like multiple medications in one go or very bad treatment or some even incurable. So I do hope that moving forward, not just for endometriosis, I really hope that in Malaysia, things will get better, like the awareness will get better, because I think as patients, sometimes to seek for help, you must first know the consequences. If you don't know the consequences of not getting like regular checkup, you don't know like why is there a need for you to do so. So I hope that with your association and many other associations, covering from many other diseases, like in the future, everyone will take like bigger steps to reach out to more people, and hopefully the Malaysian community will be more receptive in the future. But that's not for us to say. We can only hope and do our parts
Yes.
wherever we can. So keep continuing to do what you do. It's really, really amazing.
Thank you so much.
So
Thank you.
yeah, we spoke a little bit about the diagnosis earlier. So we know that definitive diagnosis typically requires a surgery like the one you have gone through yourself. And with surgery, of course, it entails a lot of risk, right? And you mentioned that there's usually a delay of like between 7 to 12 years. For yourself, it was 7 years, but it may go up to 12 years or even more for some other women. So from your experience, why do you think that is the case? Is it because there is a delay on the patient side, or is it on the provider side, like the HCP side?
Well, I think it's both. It's patient side, and their community, the people around them, as well as HCP's role. You see, a lot of times patients, when they're very young, they don't go and see a gynecologist immediately. So they go to see their GPs. And that's where the problem starts. Some GPs are able to refer, some GPs kept giving them painkillers. So I truly believe it's a community effort, including HCPs. They should all be involved in this. And we should actually reduce the year. Typically now it's just 7, 9 years, and that's not right. We have to do something about this. And like I said earlier, it's a very debilitating condition. It gets worse to a point that at one point you have to do major surgery. And this is something that we hope we can actually avoid. So I truly believe it's a community effort. Both parties have to play a role in reducing the diagnosis years.
Yes, so imagine 7 years of painkillers, and on top of that, 7 years of emotional stress and struggle, and the pressure of having to convince people that your condition is valid, like your pain is valid. It's very, very difficult indeed. And I do hope that in the future, with MyEndosis, perhaps like something can be worked out to reduce the duration of diagnosis. Well, now to address the elephant in the room. So what do you think are the main expectations, right, for someone with endometriosis when they seek for medical help? Like what is expected of the physician? I think this is what, physicians out there need to hear, and even HCPs, because when we do counseling, we don't want it to be just based on books or based on theories that you have learned. We want it to be like more personal, like to have a more personal interaction with patient, especially when it comes to a condition like this, where we need full understanding of the situation for that patient before a proper help can be offered to the patient.
So I truly believe that HCPs have a very big role. Number one would be to acknowledge the patient's pain. You see, the impression that a lot of patients got from their HCP's visit is pain was not acknowledged. And a lot of times empathy was not there in the consultation room. This is the two important factors that HCPs should have before actually coming up with solution. Okay, so a lot of times when patients don't get that support from their HCPs, they tend to not want to make another visit, or they tend to look for information elsewhere, which can be helpful as well. So this, I hope we can change, all right? We can change the perception we get from HCPs. A lot of times they look like individuals who are uncaring, they don't care, or they don't build rapport with the patient. Acknowledgement is not there. Acknowledging the patient's pain is not there. And it's hurtful if the experts don't look at us in a way that, treating us in a way that we are exaggerating our pain. So this has to change. So I truly believe that the consultation room, what happened in the consultation room is very crucial. If you're a GP, if you think there are signs that this patient has problem, then you should refer the patient to a specialist. And of course, for any HCPs, even I'm talking about nurses as well. You see, a lot of times a simple, how are you doing? Like a simple way of building rapport goes a long way in creating this health system that we all crave for. This is the thing that I feel is severely lacking in Malaysia. And I hope what we're doing here, we can actually change things. And this is a good step.
And I think these are all valid expectations coming from a patient's point of view, definitely, because if you don't listen enough, it's very hard for you to offer the right help because you don't even know where to start helping the patient. Like, I may come to you, of course, I cannot go to a doctor with endometriosis, but a patient may go to a doctor with endometriosis. And yeah, for example, their main concern would be fertility, but the doctor is not highlighting that. Or perhaps their main concern is the pain, but the doctor will end up talking about fertility issues and to conceive and to get pregnant and to solve the problem. But that's not the case. That's not what the patient wanted. So I think it's very important. So you're saying that all these expectations are still not met even in modern days?
Unfortunately not met. But I can see some improvement, a lot more improvement now. But a lot of times it's more like giving us medication without really discussing the side effects, not really talking about side effects, not really talking about what would happen if you take this hormonal medication or what would happen. So this was all not addressed. But at the same time, I am aware a lot of doctors, they have large number of patients and they can't do much in the consultation room. So I would like if there's a little bit of a change, more like acknowledging, listening, expressing empathy. That goes a long way when it comes to endometriosis. And of course, what we are trying to do in our association is this: we're also trying to teach our patients that it's a lifelong condition that has to be managed. It can be managed via modern medication as well as traditional form like acupuncture, yoga, So we truly believe that it's a holistic thing, And we needed that help from HCPs as well, especially during consultation.
Correct. So you definitely mentioned a lot on the lack of empathy from HCP. So do you think that with the lack of empathy, that will be the biggest challenge for a patient to seek for treatment? Because when the physician isn't trying hard enough to understand their situation, so that would come off as there is a lack of empathy from the HCP. So do you think that's the main issue that prevents a patient from going to see a doctor? Or you think that there are other factors that pose bigger challenges to that?
Well, I feel based on my feedback with other patients, even from my own experience, this acknowledgement is missing. At the same time, the lack of empathy, lack of listening skills, and also something I don't want to bring up, but it's true, lack of knowledge as to what is the best treatment, what is the best way to deal with patients. Because a lot of times all these HCPs, maybe they have one or two medication in mind, and they tend to force a patient to take it. Many times we do have patients who came to us and said, my doctor wanted me to take this or this. So which one should I take? So
right.
Yeah, and sometimes patients, when they are confused or they don't get the necessary advice, needful advice from their HCPs, they tend to go online. And when they go online, there's pros and cons.
Yes.
What would benefit them when they go online to seek help would be they would get information from other patients. Okay, so it's a nice platform, only a patient would understand another patient. But at the same time, it's also a very dangerous situation because we all know for a fact that endometriosis is not the same for all patients. It's very unique. And it's an enigma as well. It's not a clear-cut way to deal with patients. So I hope that when HCPs themselves create that environment, things can change. When patients get the necessary information about side effect of medication and what should be taken and what should not be taken, and empathy and acknowledgement all thrown in, we hope that things would get better. So for our association, we're working very closely with hospitals at the same time with other healthcare professionals. And we don't give a talk just like that. We get them involved as well. And it is to give knowledge and information to patients.
That's really, really nice because like you said, so back then during your time when you first started getting treatment, like what were the treatment options made available to you? Like was everything explained explicitly to you?
Not really. You see, I was given the impression in the past, this was a long time ago, Ren Zhang, I truly believe that at that time, even among HCPs, they are learning. And I was given the impression that surgery is the solution. And I've had many. All right. My first surgery was a laparotomy. And of course, after that, I had a couple of laparoscopic surgeries done. And this is probably the reason why I could not carry my babies full term. I have placenta previa and I'm unable to even conceive. It was very, very hard. So I wouldn't blame surgery, but at the same time, we patients, we are not informed well. And I was given the impression that it would help me in conceiving. It would help me in solving my problem. And that's not the case, actually. So it's a combination of everything else.
And I think all HCPs out there, they need to hear the fact that I think all patients deserve the rights to know what treatment they're getting and what are the side effects that come with them. Even if they're only giving 2 options, patients should at least be able to weigh the pros and cons of, both the options before coming to a conclusion. Like you said, internet.
Tell you this, I totally slipped my mind. Sorry, Ren Zhang. You see, even surgery, I have done a couple of surgeries, but I was not told that surgery would reduce the number of eggs or impair the quality of eggs, so this was not communicated. So this is where we need to address this. When it's communicated, then at least patients are prepared.
Yes. I do agree with that. And I think what happened to you is rather unfortunate, really, because like when there's reduction of the quality or the production of eggs for a woman, like that affects like your ability to conceive and the ease for you to conceive. So there's no mental preparation for you to get ready. Like you need the procedure because you need to get treatment for your condition to overcome the pain that you have gone through for so long. So you think that it'll be a rewarding experience. Like who wouldn't want to be treated the correct way? But I think when that is not properly communicated to you, that's very unfair to a patient. And it shouldn't happen. It's not very ethical, I would say. So I do hope that all the HCPs out there will listen to this and, will understand how important it is to communicate all the important information, especially things like this, to a patient because they deserve every right to know about it. And we, of course, as HCPs like myself, I wouldn't want patients to go on the internet to look up for information as well, because it is as harmful as it is beneficial. People can never tell apart like which information is right, which one is applicable in their condition. So I think HCPs just need to play a more active role. First to listen, next to acknowledge, and then finally the ones that they're doing now, which is to offer treatment. Because you need to understand the situation first well enough before you can offer the right care for your patient. So Yes, with what being said, Surita, I just want to find out, like, what's your view on getting a second opinion?
Okay, so I truly believe that if one particular HCP is not helping a patient should actually look for another alternative. And I always advise patients that if they're not getting the right necessary support from their own HCPs, then they should find the second help, from another HCP. But again, this is also risky to tell because sometimes patients go from one doctor to another doctor to another doctor, and they hear 3 or 4 different stories. So it's a bit risky to do that. But I always inform a lot of patients that they need to get the necessary support from their HCP if they ever want to go through this journey with this HCP. And if they're not getting it there, then they have to actually look for an alternative, another HCP who is supportive. And I truly believe that nowadays patients are a lot more informed. Okay, so because of the internet, okay, there's pros and cons about the internet. Some of them, they do have information, and when they go into the consultation room, they tend to challenge or tend to speak up about alternatives in medication. And of course, some HCPs don't quite like that. And sometimes you have that conflict in the consultation room. And I hope that that doesn't happen anymore. We hope that HCPs would be able to accept differing viewpoints. We should, as HCPs, usually they should accept patients' needs. What do they want? Is pregnancy the solution, or do they want to get pregnant? Because we have to address this. Sometimes patients don't want to get pregnant, and maybe they're looking for long-term management of their pain. Why I'm talking about this is because I have one particular patient. In the 7 years, I never had that. So there's this one particular patient who is from the LGBT community. So she actually came up and said, she actually texted us and said, where can I find a doctor who's supportive? So a lot of times when she go and see HCPs, usually will tell her to leave her partner and get married, you see? So this is the disturbing thing. As a good doctor, we have to address that people are different.
Yep. Correct.
We have our own views, we have our own needs, we have probably our own sexual orientation. So this is something that a lot of HCPs don't have, they lack this understanding part. And I hope that can change.
Yes, and I think it's only common sense. I'm not sure if it's safe to say that it's only common sense to respect the indifferences that each individual has, whether you are a HCP or not. So all the more reasons, I think, like for all HCPs out there, that we should respect all the differences that we have. That's one thing. And different opinions, because like you say, people are moving in a very fast direction towards a very modernized style of living. So people are very well informed with the help of internet. And I think like in many other countries, most of the time the patients are very well informed. So I think if a HCP has done practices out there, they would know that when a patient comes to you, it is a proper, discussion going on. Like you're not just educating the patient. The patient has a set of information, sometimes perhaps even more, because they are going through the condition. They know what medications they're taking. They know what procedures they have to undergo. I think moving forward, we really have to move in a direction and come to an understanding that this is a very fast moving world. We need to accept different viewpoints from our patients. And if you don't agree with what they have found on the internet, you give your professional input. And then there you go. A proper discussion goes on, and then you can discuss and the patient will make the ultimatum. The patient will make the final decision, because at the end of the day, it is their life, it is their condition, it is their reproductive organ, it is theirs. So it is their choice to make as well. So I think moving forward, people just need to be more receptive to, modern ideas and modern solutions, because otherwise we will always be very backdated, right?
Very, very true. And well, I have a lot of stories to talk about that. Okay, we can go on and on because I myself was once told by an expert, a specialist, that I'm unable to conceive. So because when I had my daughter, my first child, she was 7, and I couldn't conceive for 7 years. And I went to see a gynecologist, and he actually told me that my uterus is incapable of having a baby. So
the word incapable was thrown at
incapable.
you.
It was that harsh, and he actually wanted to schedule me for a surgery, a hysterectomy, a partial hysterectomy. He was actually
Right.
about that, and not really looking at what I want. I want to have another child, you see. So I was very upset, of course, and that's when I went to see another doctor who had another opinion, and I'm very thankful that I didn't listen to this doctor, because I wouldn't have my son. My son is 10 now, so sometimes we need to come to this right balance where we all work together. Instead of forcing a patient to do something, we should come to an agreement. And consultation room shouldn't be like a very stressful situation for both parties. That's what we hope to change.
Yep. And that is precisely what I hope that will happen as well, because I think there are just so many benefits to rake from the idea of, like mutual discussion, because it's for the patient at the end of the day. And for HCP, your ultimate role will be to help patient get better. And for the patient, obviously they want to get better. Otherwise, why would I pay money or to spend time to seek help from a medical professional, right?
Yes.
So yes, like you said, it's been so interesting talking to you. Like, we're just talking. I didn't even realize that 1 hour plus has already passed.
Thank you.
Yeah, but I think we have touched like most of the aspects that we need to touch on. So let's just jump very quickly. I think I believe that the people who are still here, they would want to listen to what advice you have for the women out there, who may or may not be suffering from endometriosis.
Okay, my advice is very simple, and that's the objective of our association. If your period pain affects you, that you cannot perform your work, you cannot function normally, you cannot be a mother, or you can't be in the community, then you need to do something about this. Period pain is not normal when it's debilitating, and we have to end this silence. So we hope that by addressing this issue, people in general would know the trigger point of when to seek treatment, when to know when something is not right. So that's what I want to emphasize here for all patients. And for mothers out there who's listening, if you notice that your daughter has these signs that they are facing problems with their menses and their condition is quite bad, you need to actually bring them to a gynecologist. So don't wait to a point where they are married or whether they have problem in conceiving. So that's one thing I want to highlight here. That's the objective of our association as well.
And very well said. A very, very well-defined objective as well. So you've mentioned about the importance of getting proper support. So what advice do you have for the men out there, like with regards to endometriosis? I promise I'll pay attention.
So I truly believe that this is not a women's issue. It's a community issue. So because women with endometriosis, they are mothers, their sisters, their employees at work. So even employers, they should know this. And I truly believe that men shouldn't shy away from this. And they should be receptive, especially if they have spouses or, if they have sisters and even daughters. And the interesting thing is I see more men opening up, but we have a long way to go. I find a lot of difference now. I do see that when we do events, women coming with their spouse, and that's a breakthrough, I find. But again, like I said, it's a long way to go. We have to break this taboo of looking at this condition as just a women's issue. It's not. It's a community's issue.
Right. Indeed. Very, very well said. So I do hope that like all our hard work, all your hard work and all your team's hard work will pay off. It's starting to pay off, I'm sure, like
Thank you.
for so many years. So let's hope that more people will come forward and, not be ashamed of their condition, not be ashamed of their family, their wife, their, employees' condition, to be more understanding and to offer proper support to them. Because with proper support, I believe that every woman with the condition will be able to function as well as anyone without them. So let's hope we can get to that direction one day. And I definitely look forward to, like more possible collaborations between like pharmacists and perhaps MyEndosis in the future, perhaps as a way to include us in the program.
And I hope that more pharmacists would be able to join us, because we need to get rid of this impression that it's just a patient society. No, it's open to everyone. Even healthcare professionals can join us. They can be in our committee. So if any of you are interested to join our association, do look out and look at our page, EndoMarch Malaysia. And do see what's going on. We're going to have our AGM very soon. So again, inviting everyone to be part of our community to create awareness on endometriosis. It's time to end the silence on this debilitating condition.
Here.
Thank you. Thank you so much.
So this video will be shared out on the website as well. So anyone listening to this, know that you are always welcome to join the association and, to offer help to women out there who suffer from endometriosis. I think it's a very bold move and it's a very noble one as well.
Thank you so much.
So anyone in the audience, that you have any burning questions that you want to ask Surita, I'm sure she has prepared, information worth buckets of water to put out those burning questions.
Yeah.
Let me check the chat. Okay, no one's posted anything in the chat box. Anyone? No? So if they do have any questions for you, Surita, like how can we direct their questions at you?
Okay, you can actually, Jonathan knows my number. I don't mind giving, I give away my number freely. Okay, so I'm actually eager to connect with so many people. And of course, you can always contact me via WhatsApp. And of course, we have an email, endomarch, endomarch.malaysia@gmail.com, or you can go to our page, EndoMarch Malaysia. At the same time, we have a website. Our website is known as MyEndosis.org. So you can actually check there and see, we have shared some patients' perspective. And of course, we shared patients' story from different backgrounds, married patients, unmarried patients, different races as well. We want this to be a community effort to create awareness on endometriosis.
So yes, to anyone listening to this, if you have anyone suffering, if you know of anyone who suffered from endometriosis, or even yourself, or even if you just want to get more information on endometriosis, so remember all the possible channels that you can link with Surita and her team.
Yes.
So I guess we'll call it a wrap a bit earlier, but it's been a very nice session.
Thank you. Oh, okay. We have 15 more minutes. Okay. Thank you so much, Ren Zhang. I'm truly happy to do this. And this is our first connection with Pharmacists Association, Pharmacist Society, and of course the Young Pharmacist chapter, if I'm right.
Yeah, correct.
Yeah. So once again, I hope some form of collaboration could work out. I also need to address this. Pharmacists also play a big role. When they are in the counter of any pharmacy, sometimes they can actually help a patient. And I'm going to tell you this honestly. Last year, I had a very refreshing experience when I went to a pharmacy and I spoke to a pharmacist. And I didn't reveal to her that I have endometriosis. I just said I wanted a painkiller. And she asked me, why do I need it? Why do I need the painkiller for? And I told her roughly what it is. I was in a rush. And I was so surprised when she told me, she said, Miss, if you have this much pain, I think you should get it checked. And this is my first time getting a very nice environment, a pharmacist that's willing to help and willing to advise. She said, this is not normal. There are so many other factors, could be fibroid. And this is coming from a pharmacist. So we hope that more and more healthcare professionals, especially GPs and nurses as well, would be able to identify patients on a regular basis and probably help these patients by just giving them some information. That would be helpful.
Yes, and I trust that platforms are already made available, so we might as well utilize them for more possible future collaborations to work together to help all these patients out there.
Thank you.
Thank you very much. Thank you very much for joining us on our podcast. And to our lovely audience, thank you very much for joining us and for taking time off your weekend to join us for this podcast. So I definitely look forward to more of this podcast in the future segments. So let's hope that this podcast is something that will continue to go on and it won't just stop here, so that we can reach out to more, people out there. Thank you, everyone.
Thank you so much, Ren Zhang. Thank you, Jonathan. Thank you, everyone. Bye. Take care.
Bye.
Bye.